One. And we're live. Good afternoon, good morning, good evening, wherever everyone is watching this from. I am really happy and feel privileged and honoured to have a chat, another meaningful conversation, as we called it, with Dr. Scott. Dr. Scott, I met through Edward Zier's networking, and actually Dr. Scott is a Chinese herbal medicine expert and acupuncturist, and he has stuck needles in my head and through my hand on a demonstration, actually. So, Dr. Scott Fox, how are you? Lovely to have you here. Say hello to everyone.
Hi, everyone. So, I'm Dr. Scott from Sixth Sense Acupuncture. I'm a registered acupuncturist and Chinese herbalist. I'm based in the north of Brisbane in a suburb called Kalanga, but that's going to change soon. I'm going to go mobile, so be able to treat you guys down the coast and up the Sunshine Coast as well. So, looking forward to doing that too. Thanks, Karen. Thanks for having me on too. Appreciate it.
Welcome. And so when you say you'll go to the Sunshine Coast as well, do you think you'll have days that you offer to be there and days that you come to the Gold Coast?
Yeah, there will be a prerequisite. So if someone wants to book me in on the Sunshine Coast, Gold Coast, they'll just have to have 2 friends with them.
Okay.
So I treat 3 people. So it makes my worth my while.
Wow. And so, Dr. Scott, tell us how you actually got into the world of Chinese acupuncture. Is it Chinese acupuncture that you do, or is it Japanese or Korean? What type do you do? What type of needles do you use? But also, what brought you to this point where you went into this health field?
So I'll answer. So I do Chinese acupuncture, but it's a different method to what they're taught, what we were all taught in university. So good example is if you've got a shoulder problem, I don't actually stick the needles in your shoulder. The same for you, Karen, the day that I did that demonstration. You had a neck problem, but I didn't go anywhere near your neck. I put them in the forehead, into the crown, and also into your hand. So I didn't go anywhere near your neck. Now there's 2 reasons why I do that. Number one is, I can't make it worse. So I don't know if you've ever seen someone with gout before. It's horrible. They get that swollen big toe or big ankle, and you can see it throb. You can actually see it. And you say, oh God. So if I stuck a needle in that, they're probably going to want to punch me. So I don't want that to happen. So what I would normally do is I'd probably stick it in either the thumbs or in the other toe. And also, so that's one reason. I don't want to make it worse. And also the other reason is like with your neck problem, if it only hurts when you turn your neck, and I stick them in your neck, well, then you can't move your neck. So if you put them outside of the neck on the scalp or in the hands or in the feet, then you can move your neck around and then you can feel the difference immediately. And it takes 10 seconds. And you would know that, Karen. It's pretty much immediate. So I'll get into that later if you want to talk about that. So the reason, so I hope I answered the first lot of questions. So the reason I got into Chinese medicine was actually when I was a teenager. I used to do Taekwondo, so Korean martial arts. And our teacher, Master Moon Lee Taekwondo, he taught us a bit of hand Korean acupuncture. So just like reflexology, they use the foot as a map. Well, the Koreans do the same thing, but with the hand. So we'd punch each other, we'd kick each other, and you get bruises all over you, and you do some needling on your hands after the training, and the pain would go away straight away. And also, if you got the flu or something like that, I remember I'd needle myself, and like the flu symptoms would dissipate. They wouldn't go completely, but they'd reduce immediately. So I thought, well, there's merit in this, because it was working so well. I think as well, I was very young. I was only in my teen years, so probably responded a lot faster as well when you're younger.
Mm.
And then, but like with everything, it cost a fortune to go and learn. And the other thing is, it wasn't recognized back then. It was like taboo. What the hell is this acupuncture? In our culture, in the Australian culture, it was never ever talked about. You never go and see the Chinese medicine doctor for anything. So, we had no idea what acupuncture was. Unless you trained in martial arts, you had no idea. Same with Chinese herbal medicine. We never ever heard of it until I, trained in martial arts. So my father knocked that one on the head very quickly. Cost too much. And so I thought I'd just wait until it was more recognized. And then to stoke the fire, my mother passed away in 1994. And she had a rare type of cancer. She was only 55. She was very, very young. So from diagnosis to death was 6 weeks. So it was really quick. So she had a rare type of cancer. It's called urethra cancer. So it's where we pee. And it metastasized. What does that mean? I mean, it went through the whole renal system, got into her kidneys, in a bladder, and then into a liver. Once it got into a liver, that was it. Pretty much her whole system shut down. So, and of course, they just kept cutting her away. And I kept asking the surgeons, what can we do about this? Is there anything else we can do besides cutting her away? I couldn't understand why are we cutting her away all the time? Like, is there some way we can improve the immunity? Because they brought that up. They said, it's her immunity can't fight off the cancer. And I was like, well, is there some way we can enhance that? And of course, they, we know what we're doing. We're cutting the cancer up. Yeah, but that's good. That's great. But you're cutting her away as well. So, so she basically, they couldn't do anymore. The cancer just proliferated too far, and they cut too much out, and basically all our organs shut down. So that was it. That's when I thought there's got to be an answer. This cutting people apart and taking all their organs out this doesn't sound right. It doesn't make sense. There must be some way of preventing this from happening. So that's when I went on a quest. So then in 2003, it was actually late 2002, I found out that they were offering degrees in acupuncture, and at the local school here in Brisbane, in the Valley. It was called the Australian College of Natural Medicine back then. And I started part-time. I did it part-time. And then in 2008, I got a job in the hospital through Queensland Health. And I was a security guard. And of course, I'm learning all this health sciences information from the uni. And of course, it's right in my face. Like I can go and ask, like the consults in emergency, and I'd ask them 1,000 questions. What about this condition? What's good for this? What would you do? What was the they call it a prognosis? So what would happen after you've done this to them? So I'd ask them all those questions, and of course I'm watching what they do to people. And Karen, they look in emergency and ICU and the birthing suites. I saw miracles. I saw amazing things. I saw a guy actually cut his hand, severed it completely off in a motorcycle accident. And the next day, I went and watched the surgery they did to him. And the next day, here he is. He's moving his hand around. I'm like, it wasn't like that, but it was rigid. But he could get movement back. I was like, wow, amazing. I saw another guy split his head open, and they had to put a metal plate in his skull to replace it because the skull had been crushed. And getting around like nothing ever happened. I was like, wow, amazing. And I saw in the birthing suites emergency cesareans. It was amazing. The baby wasn't sitting properly. And it had cord. Actually, the baby had actually started to suffocate because the cord had wrapped around its neck.
Mm-hmm.
And of course, Mum was getting preeclampsia, so her blood pressure was going through the roof, and so was the baby's. So they had had to get the baby out as soon as possible. So you see what I'm saying? They're really good at the acute stuff. They're fantastic at it.
Yeah.
But then I went into the other units and I watched like mental health, for instance, the cardiology units. That it wasn't good. The anything chronic, so that's for a long time. I found it was very limiting to what they could do. There's pretty much only two things they could give you, and that's medication and surgery. And like nutrition. Like I saw the nutrition that they were giving the patients in the hospitals. I was thinking, yeah, I don't know if this is the right thing you should be giving to a patient, for these conditions. But anyway, that's the way it was. And yeah, then I graduated, and there was another problem as well. So it affected me as well because I was doing shift work because I was in the hospitals, and I also was working in clubs and pubs, and I was doing crazy hours, and I became an insomniac. I couldn't sleep properly. I'd get no more than 6 hours sleep, and it was irregular. I was all over the place. I was doing, the shifts are all over the place. So was my sleeping clock. So at the hospital, the employees have their own outpatients. So you could go to a GP whenever you wanted. And I basically walk in there every 2 to 3 weeks, and he would basically say to me, "What do you want?" So I got hooked. I was hooked on temazepam, which is like Valium. Actually, it is Valium. Panadine Fort, because the codeine actually helps you to sleep. But yeah, like with any opioid, codeine is an opioid. It makes you constipated, so it caused other problems. But and also I was taking melatonin, so he was giving me melatonin prescriptions. Melatonin is what helps us to sleep. Serotonin keeps us awake. Melatonin helps us to sleep. So, and I found that those drugs worked about 3 days, usually about 3 days, and it just wouldn't work. So I'd have to try something else. So that's what I was doing. I was going from temazepam to Panadine Fort, then to melatonin tablets. And then to make it even worse, I found that if you had a couple of glasses of wine with it, it actually heightened the effects of the drug. So, but the next day I felt like a zombie. So and that's really dangerous because then you're self-medicating, and I didn't know that at the time. But then afterwards, I started talking to other doctors about it, and they're like, "Yeah, you shouldn't be doing that." So you see what I'm saying? That and I'd go back to the GP, the employee GP, and he was just like, I got nothing for you, mate. Like, this is it. This is your regime for the rest of your life. I said, what? So I was thinking to myself, this is exactly what was happening to my mother. There's no different. This is, and I'm seeing this in the hospital, all these patients that are coming in. I'm thinking, this is exactly the same. I'm in the same boat as everyone else. And that's when I realized that I had to change that around. So this is, I'm talking like early 2010, 2011, 2012. And then I graduated in 2014, and that's when I started to change everything around. So I started doing acupuncture on myself every day. I started changing my diet because those drugs make you really lethargic, and I just piled the weight on. And I realized that I had to change my diet. And the other thing was I said to myself, I can't do shift work anymore. So I started working on my clinic. So I started working from home, and I was doing, working during the day and wasn't working at night as much. I was still doing it because I was still involved in the hospital. And then I relinquished my security license in 2018. I stopped working in the hospitals completely. And by then I was sleeping like a baby, and I was drug free. So I basically got myself off all the drugs. Actually, it was 2015. I stopped taking the drugs. And then it took me about 3 years before I completely, was sleeping like a baby again. And then in 2016, that's the other thing. 2017, I started my herbal degree. So I went to Melbourne, Royal Melbourne Institute of Technology. So they were the only ones that provided the master's degree in herbs in Australia.
Mm-hmm.
So that was recognised anyway. I could go overseas, but you got to fight. You got to fight with the registry board to get it recognised. So yeah, I finished that in December of 2019. So I knew other students that actually didn't finish, and they continued into 2020, and it was a mess.
Oh my gosh!
So yeah, so it was pretty much a self-healing journey, but also to help others, because I realized that the system that we have in place, as I said, it's fantastic for acute medicine. Absolutely amazing things that I saw. But when it came to anything long-term, chronic disease, they call it, it was very lackluster.
Wow, Scott, that's an amazing story. I want to speak to some of the points you've made. First of all, I want to say I'm really, really sorry for your loss with your mum, and how it happened must have been very, very upsetting for you. However, the good thing that's come out of it is it has given you this desire to delve into health in a way that you do now. Interesting that you say that there wasn't much acupuncture around when you were that age. I'm probably 10 years older than you, or maybe more. And I went from New Zealand, and me and my parents had also used acupuncture. I used acupuncture when I was, pretty young, either in my teens or early 20s, which is going back 40 years. So New Zealand is a bit more open to different things, I think, than Australia. We're not quite so programmed in New Zealand. We're more, we have a more, as I say, sort of open mindset, if you could generalize in some ways. So I got introduced to acupuncture, and in fact, for many, many years, I only went to a lovely Chinese lady who was a little bit similar age to me. For everything, I went to her. She was a Chinese herbalist and acupuncturist. And she explained to me how she had come from China. Of course, she was Chinese. How when she did her training in health and medicine, they trained them in the 3 areas. They trained them in the herbal medicine, the acupuncture, and to some degree the standard kind of medicine. And she was so interesting. I found her really interesting because she would tell me about how they had in China many different diseases, because China is such an old country, and you probably know this, Scott, that they had many different diseases that people would come to them with and could be put into hospital with, that in New Zealand, for one, I don't know about Australia, they hadn't come across these diseases before. And so she was also able to heal people with her acupuncture and Chinese medicine for some pretty drastic diseases that the rest of the medical profession had sort of thrown their hands in the air and said, we can't do anything. And, one was, a 16-year-old girl who had this kind of flesh-eating disease. And this woman knew about it from China. And she said, they said she would be in a wheelchair for the rest of her life and all these different things. And this Chinese lady healed her. So I'm really interested in what you do, and, what other people do in your realm of health. So what was your degree that you did in, Dr. Scott? Was it in Chinese herbal medicine, or did you do a normal medical degree, or what?
Funny you say that. So
you
I've
might
got a
have
degree.
told me, but I missed it.
That's okay. So I've got a degree. I'll start. I've got a diploma in Chinese massage,
Mm.
I've got a degree in acupuncture, health sciences
Mm.
acupuncture,
Mm.
and I've got a master's in applied science, Chinese herbal medicine. So
Okay.
funny you say that, because that's 7 years of learning, right? So I had,
Yeah.
so that's the same as what a GP would have to do, or a surgeon.
Yeah.
They have to do
Yeah.
7 years of training. So
Especially.
the funny thing is that I have to learn everything that a GP has to learn,
Mm.
but they don't have to learn what I have to learn.
Yeah. Yeah. Exactly. Exactly. And they're not taught. They're taught what
Yeah,
the Western medicine system teaches them.
yeah,
And I've spoken without any disrespect for anyone in that field and anyone with that qualification. I've spoken to many people who are experts in their field. For example, Dr. Liz in nutrition, and she is a professor, so she's right at the top of the game. How many doctors are not taught anything about nutrition, or very little.
yeah,
It's maybe a few classes as part
yeah,
of their degree, and the same in the midwifery and nursing profession. So they are general practitioners. That's what GP stands for. And when they do their without, as I say, without any disrespect to that profession and that industry, there is a whole nother health and wealth world out there for those people who want to look further. So
yeah. That's
yeah,
right.
I love what you do. I want you to tell people a little bit about, and because you touched on it. First of all, there is a message from a LinkedIn user. I'll just address that. He says, "Hello from India. Is there any medicine for kids' fever every month? Kids' fever.
Fever every month. There's
Yeah.
an interim. There's a come and go. Sounds like it comes and goes.
So
I'd have
if
to
you're,
ask. I'd have to ask more questions, but
yeah, that
uh,
might be in India. I think. Yeah.
so in Chinese medicine, you'd probably use the
Mm,
cooling herbs. So
mm,
they're in pinyin. So Huang Qin, Huang Lian. So Huang means yellow. So Qin means upper. Huang Lian is like the middle, and Huang Bai is the lower. So I'd probably use a formula like that to cool the
mm.
blood. But it depends. I'd have to inquire more and find out more. But that's as a general rule. That's probably what I would. It's very bitter, but very bitter. Oh, bitter herbs.
And Scott, it's interesting that what you just said, because once again, if you go back to GPs, they don't make the medicine. They just prescribe it. You actually make it up. You understand
Mm.
so much about the body and the herbs and how the herbs affect the blood and the body and the muscles and the organs, that you prescribe for the patient the exact combination of herbs that will deal with the problem, correct?
Yeah, yeah. So the Chinese were very sophisticated in uh, figuring out what herbs treat what organ. So that's the difference between what what Chinese medicine does in comparison to conventional medicine. Conventional medicine treats the disease. So if it's a virus, if it's a bacteria, or if it's infection. Whereas in Chinese medicine, we treat the organs. So it depends on what organ that is involved. So I'll give you an example. So
Yeah.
for depression, for instance, so depression is usually because the liver, how can I say, it's fatty.
Okay.
Sluggish is another name.
Okay. Okay.
So pretty good chance they got a fatty liver if they're depressed. So what I would do is I give herbs to increase blood flow into the liver. So then they feel, well, the other thing is the liver isn't processing the nutrients properly. So then they'll feel heavy because the nutrients aren't getting carried around the body properly and aren't being filtrated by the liver. So they're going to feel heavy, and they're just going to feel lethargic. They don't want to do anything. So if you increase the blood flow into the liver, then the liver will be able to filtrate the blood itself, and then they'll feel so much better. They'll feel more energetic. They won't feel so down. So that's just one example. So anxiety is another one. So in Chinese medicine, anxiety is to do with the heart. So there normally is another symptom that goes with anxiety, and that's palpitations. So it's because the heart isn't pumping the blood to the brain, and the brain takes up 30% of our blood supply, right? So if the heart isn't doing what it's supposed to, and let's pump the blood to the brain, then the brain's going to panic. And the only mechanism it has of trying to get more blood from the heart is to think too much. So then that gets worse. The acerbation of, and then then eventually the anxiety becomes too much, and then they'll get the palpitations.
Wow.
Now, so as I said, the organs are the ones that control what's going on in the body. So we just give them herbs to increase. Same thing. We just give them herbs to increase blood flow into the heart itself, and then what anxiety? And they sleep better too. So that's another problem. So people can't sleep properly. So that's normally a heart issue. Normally the heart itself isn't pumping the blood to the brain. Same thing. They'll think too much at night, and they won't be able to sleep properly. And they're tired all day. The more tired they get, the more anxiety they'll get, and then the palpitations happen.
Wow.
So it's a dominoes effect.
Gosh. So can you tell our people listening, and who will listen to the replay later, can you tell them why or what it is that works when you give the needles somewhere else in the body for a different part of the body? What is that process, Dr. Scott?
What's going on there?
Yeah.
So you'll see. I actually did a demonstration a couple of weeks ago at another networking group, and you can see there that I actually do explain it. But in short, basically what's happening is, so when people come to me, normally I'm the door of last resort. Like they've already been to the physical therapist, been to the chiros, they've already been to the GPs, had their cortisone injections. So they've definitely got a chronic problem. So they come to me. So what I'll do is I'll ask them, what's the pain out of 10 first, like with your neck problem. So, and I'll get them to twist their neck, and I can see the range of motion is limited. And I'll ask them, and they might say, 6, 7 out of 10, depending on how far they rotate their neck. And then what I'll do is I'll put either needles in the scalp, or I'll put them in the hands. And then I'll just ask them again, like I did with you. I'll ask them again, what's it out of 10? And then they'll say, it's like a 2 or 3. So then I'll do some more needles, and maybe in the other hand, or maybe in the foot, or depending on what I'm thinking at the time. And then eventually the pain will just go. Now, why? Why does that happen? So what actually is the problem? It's actually the midbrain. So the midbrain sits at the top of the spinal cord and at the bottom of the brain itself. And it takes in all our sensory information, more importantly, our pain sensory information. So I was getting a pain signal from your neck, but it doesn't know why. And because it's been there so long, it thinks the worst. It thinks it's poisonous. It thinks it's infectious, septic. So it's willing to sacrifice, the midbrain is willing to sacrifice your neck to save the rest of your body. Why? Because it doesn't want the poison to spread. Now, how does it do that? How does it stop the poison from spreading in your neck? It cuts the blood flow in and out of the neck itself. And that's why it gets stiff and weak. So think of it like you put a rubber band on your pinky. So over time, eventually it will get stiff and weak. And eventually it'll get painful, and probably go black. So all I do is I basically take that rubber band off the little pinky. Now, how do I do that? So via your neural system, I'm just telling your midbrain it's not that bad. Let's send morphine to that area immediately, to your neck. And that's what you were doing that day, Karen. You were sending, your brain was releasing morphine. They're called enkephalins with a K. And these are a hormone that are released by the endocrine system, and basically they release morphine. And that's what kills the pain. Now, once the pain's gone, then the midbrain wakes up, and this all happens simultaneously, right? This all happens all at the same time. The midbrain wakes up again and says, "Hey guys, it wasn't poisonous like we thought it was for however long you've had the neck problem for." And then what does it do? It sends more blood to the area, to the neck. And that's the most important part of the treatment, Karen.
Yeah.
Why? Because blood supplies what? Oxygen, nutrients, and it's a clean away truck. It takes the garbage away. So have you got any bone spurs, cysts, viruses, bacteria, cancer, infection? It breaks it up and takes it where? Kidneys and liver. And then you either poop it out or pee it out. Now, to answer the question is why do I, if I stick them in your hands or in your scalp, why does that trigger the neck? Well, actually, they figured out through PET scans that there are certain spots that actually light up the brain like a Christmas tree. So the Chinese were just smart. They didn't have that but. So how they figured it out, I got no idea. To be honest, I got no idea. But we figured it out through PET scans that in certain spots you'll actually trigger more blood flow into certain areas, depending on what part of the body you're trying to send that blood to. And that's basically, yeah, they figured it out. I don't know how, but they did. Because they didn't have any imaging equipment.
Right.
And that actually too, what's that?
We don't think they had any imaging equipment. Maybe they did. Maybe technology was already advanced, and then,
Yeah.
I've been to Egypt, and you would think that they had such advanced technology like hundreds and thousands of years ago because of what they've done there, and the gold inlays and the pyramids, how on earth they could have lifted all those massive big blocks in those days without cranes and things. You would think they had advanced technology before we came along with advanced technology. Maybe they did in China as well.
Maybe, yeah. So that's another good point, Karen, is I practice the emperor's medicine. So you got to remember the physician for the emperor's court, he had to get a result. He had a lot of pressure. He lost his head if he didn't. Yeah. So there's a little bit of pressure there. So that's what separates me from other acupuncturists and Chinese herbalists too. I forgot to say that. Is what I actually do is in my initial consultation, I feel this artery here in the wrist.
The pulse.
And basically, yeah, so it's called the radial artery. So the radial bone's just here near the thumb. And that artery basically tells me about the other arteries in your body, but more importantly about the heart and the organs themselves. So the Chinese were, they're amazing. They figured this out. So because you think about it, if the emperor or empress, the prince or princess, they're only 1 year old. They can't tell you what's wrong. There's no imaging equipment. There's no blood tests to tell you what's going on. So how'd they figure it out? Through the pulse. And they had to. Because like I said, a lot of pressure. So they had to figure it out.
So what about, I've heard about this. I've heard some things about the energy flow through the body, and that we have meridians and they get blocked, or the flow gets blocked. Do you speak to that, or just your explanation before is where you live?
Yeah, so in uni they did in university they did teach us about the meridians and energy fields and flow and chi is energy. and what was the meridians. So meridians are these energy channels. They get run through the body. That's what they taught us at uni. For me, it's, if it's speaking to a Western audience, it doesn't sound right. It's a bit wishy-washy. And for me, now when I look back, I think, probably wasn't the right way to explain something to the students. For me, the meridians, I call them neurological channels.
Mm-hmm.
So they're channels of neurons. So that because at the end of the day, all the neurons are connected.
Mm-hmm. Yeah.
So just that they gave them funny names. That's all. So and chi for me is oxygen. The translation is oxygen,
right?
Because it flows everywhere.
Right.
So there was a gentleman, a French gentleman in the 1920s and 30s, wrote, I think, 6 books on Chinese culture, and I think 2 or 3 of those were on Chinese medicine. And meridian actually comes from this Salid de Moron is his name. He was a diplomat. He was a diplomat in China from France. And the problem is, meridian actually is a French word. So no one before him said that there were meridians in the body. So see what I'm saying? So, and the same with chi. Prior to him, no one ever said that chi was energy. So so the problem is the universities are running with that now, and that's okay. That's fine. But when, like I said, when you're talking to a Western audience, it's what doesn't make sense.
Yeah.
So it's better to say. So it's better to explain. Yeah. So I talk about blood. So not so much chi. So acupuncturists talk about chi, whereas herbalists, they talk about blood. So it's weird. So for me, it makes more sense to talk about we're promoting blood around the body. It makes a lot more sense. How do we do that? Via the neural system. We're just tricking the brain into sending blood to where we need to send it. So then we heal naturally. So that's the difference between conventional medicine and Chinese medicine, is that we promote
healing.
blood, we promote healing, whereas conventional medicine, medication anyway, it only does 2 things. It either mimics something that you produce, thyroxine, estrogen, progesterone. Those drugs mimic what we already produce, or it inhibits something. So selective serotonin reuptake inhibitors. So they're antidepressants. So they either replace something or they inhibit something. So which is something that we don't do. We promote. So if there's an organ that isn't providing a hormone, for instance, then we help that organ to promote that hormone. Or if it's producing too much of it, we help it to regulate that hormone in that organ. That's the power of the Chinese. They were so smart. You got to remember, this is 2,000 years, well, at least 2,000 years. And these weren't the village idiots. These were the smartest brains and the smartest minds in Chinese history. So and like I said, they had a lot of pressure.
Exactly. So, Scott, why do you think that Chinese medicine, because like you say, it's so much older, the culture is so much older, the learnings are so much longer, and clearly they had amazing results. Why do you think that the Western world has actually in many ways turned it away and not taken it from there and moved it into the Western world and adopted it and taught people and used it? Why do you think that is? Is it political? We don't want to get into politics.
That's a loaded question.
No, I didn't mean it to be, but yeah.
Can I go back to the Rockefeller Foundation?
Okay.
So
I got your answer. Yeah. Yeah.
so
Yeah.
so
Yeah.
it's one thing that this is one thing that I explain to my patients on the first day. I get them to smell herbs on their first
Mm-hmm.
day and
Mm-hmm.
get them to try and tell me what they are,
Mm-hmm.
because so herbs have distinct smells.
Mm-hmm.
So I get them to smell cinnamon, ginger, fennel, uh,
Mm-hmm.
cardamom,
Mm-hmm.
and licorice root. And the reason why I do that, and most of the time they can't tell me what it is. So um, why I do that is because those herbs will be in their pantry. But the thing is, they don't know why. Why do you have the?
Right. Right. Of
Why are
course.
they in your pantry? Why are they in your pantry? Because in Chinese medicine, they would be something that I would give to you if you had stomach issues,
Mm-hmm.
and that's why they're in your pantry.
Mm-hmm.
But the problem is that information hasn't been handed down.
Yes.
So
Yes.
our great grandparents would have known that.
Yes.
Why? Because they had to grow it themselves. We don't do that anymore. We have to go down to a store and buy it. And if you ask them, you ask the store manager, which I've done before. I've gotten them down. I've got the store manager down. Can you tell me what these are for? They have no idea. They
Yeah,
have no idea.
that's true. And not even why we have them, why we have cinnamon in our apple pie or why we have ginger
Yeah,
in something. And, I can remember when my kids were little and we used to give them even ginger nut biscuits if we were traveling because they'd get car sick, and sometimes it would help. Or
yeah,
some kind of ginger for nausea or car sickness, as you say. Even though it's probably bad, but things like ginger ale for nausea can actually be quite good in some cases. I don't know what you think of that, Scott.
yeah.
Ginger
So
beer, ginger beer.
the problem is, it's like licorice. Licorice is a good example. That's why I get them to smell licorice root, because it doesn't smell anything like licorice. The licorice that they sell in the shops, because there's 99% sugar,
Yes,
and the other 1% is a chemical that makes it taste like licorice.
yes,
So it's the same thing. Same with ginger beer. It's it's all
yes.
sugar and
That's what I mean. It's got the other, yeah. It's got
yeah,
the other things in it.
it's got chemicals in it to make it taste like ginger.
And, on that note, if we just move a little bit further along, and you talked about the liver and the job of the liver to filter and to filter out the bad boys and to, allow things to go through our day, go out. And then you look at what you're putting into the body with drugs, with painkillers, with other things that Western medicine uses. And what happens to the liver when that sort of regime is adopted for decades and decades, and people have been doing that, and then in their geriatric years? What's your comment about that?
Oh, okay. So with dementia, you mean? Um, and because it's
Or with any issues that might come up after taking, well, like you said, your doctor gave you those things and said you'll be on these for the rest of your life. I know people who have been told you can take this antidepressant for the rest of your life. I know I worked in when I was in New Zealand a long time ago. I did sales for those medical alarms, or for those alarms where mostly elderly people or people who had an issue could get this alarm that they had really close to them all the time. Maybe they wore it on their wrist. And if anything happened, they would press it and the ambulance would come. Okay. Now I had to go and see those people and list any medication they were on. And, most of them were elderly. and there was always this list. I would know what most of them. It was painkillers, it was sleeping pills, it was anti-inflammatories, it was heart blood pressure pills, it was often cholesterol medication. They were all the same. They all were on this list. And I'd say to people, what's that for? Oh, I don't know. My doctor just told me I have to take it.
Yeah. So, yeah, God told me. So
yeah, exactly. And particularly people in that age group, they do look at GPs as that level right up here. And I say when we went to the doctor when we were little, my mum would put our best clothes on for us to go and visit the doctor. You know,
yeah,
and
same for me. Yep.
Yeah. So my question was around when someone with just the way that all of these medications are prescribed and then kept. People are just kept on them often for decades. What does that do to the organs? What does that do to the liver and the kidney and things like that? Does it have any detrimental effect in your opinion?
Yeah, so I actually had a patient, was it last week? And it was his mother. Actually, it was his mother. And she was on multiple medications. And they basically said, you can't continue to take these because they're going to kill you.
Mm-hmm.
And this is the question I have for the medical fraternity is, when do you decide that the medication is hindering their health? And when do you decide that the medication is beneficial to the patient? Because for me, that's only hindering their health.
And what's the alternative? What's the alternative?
Well, yeah. Like I said, that the first thing is to, because the medication is going to wreck the stomach. So the first one to go after is the stomach for me. Stomach and also the heart. The heart is the other one, because if they're on high blood pressure medication, that's going to cause, gut issues. It's going to cause a lot of dizziness. They're going to feel tired all the time. So if we can slowly get them to come off those medications, that I found that the stomach starts to get better itself, and then they don't have to take the antacids, the protein pump inhibitors, because they're getting heartburn and they're getting diarrhea, laxatives, and constipation.
Diuretics. A lot of people are on diuretics meds.
The other thing is, if you fix the heart, like I said before, your brain starts to get better too. Because now your heart's pumping the blood around the body properly. Then they're not thinking, they're not overthinking, and they sleep better. Once they start sleeping better, why are you taking patients? So many patients that I've found that are elderly, they're taking Valium.
And sleeping pills.
Yeah. So temazepam, diazepam, lorazepam. The lorazepam seems to be the drug of choice for the elderly for some reason. So why are they taking the drug if they're sleeping okay, if they're sleeping well? So that's why I try and help the patient to talk to their doctor, and let's try and get you off some of these medications, because the medications, they've got to take. It's a dominoes effect. They're taking one drug, and then that causes an issue, and then they got to take, and then they end up on 20. And I mean, how do you know what's working and what's not?
Yes, that was what I found. As I say, they all have this list of 10, 15 medications. Yeah.
And
wow.
It's like I always say, there's tons of research for a drug that works for one condition, or might be a couple of conditions. Okay. But when they put that with another drug, there is a zero research that says that those two drugs won't interact with each other and either nullify each other, heighten each other, or kill them. They've got a fair idea, but they don't. They're not, it's not an exact science.
Right. Wow, that's pretty scary. That there's research on all of the drugs and the conditions, but there's very little research on the combination.
Yeah.
So Scott, our LinkedIn user has made another comment, and because he said, "Is there any medicine for kids' fever every month?" And then he said, "Antibiotics taking every time, immunity down, so to increase the immune." Oh, I think he might want to increase the immune.
Yeah, increase it.
Because they're taking antibiotics each time, which is correct. So what would you say to that?
Yeah, same again. I'd have to ask more questions.
Absolutely.
But they're obviously treating infection, so they think that it could be a bug of some sort. As I said, so it would just depend. I can't really answer it confidently anyway, without asking more questions and to find out more about. But that's when they're having fevers all the time, that's not good.
And I'll just say, please reach out to Dr. Scott on LinkedIn. I have another question from someone called eJazz, and he says, "Please tell me the treatment of medicine for hemorrhoids." And he's eJazz from Pakistan. Yeah.
Yeah. So I'd have to same thing, but the formula I think of straight away is Gurja Zuyutang. So it's a blood moving. We call it a blood moving formula. And it's Shao SHAO Fu Zuyutang. So it's a formula that moves the blood in they call it the lower jiao. So it's basically for the navel down. So any sort of we call that like nodules. That's what hemorrhoids are. They're not nodules and scar tissue, and basically it helps to move the blood. You probably need a laxative to go with it. I'd probably give Yin Chen Hao Tang, so it's got a lot of Da Hong, which is a laxative. It'll soften the stool as well, so they don't when they go there, it doesn't hurt so much.
Yeah.
So that's probably the two formulas I think off the top of my head.
There you go. So, Dr. Scott, is there anything that, apart from, like you said, urgent broken bones, urgent situations like cesareans, and things like that, is there any condition that you don't or can't treat with Chinese herbs or acupuncture?
So I found it really difficult with motor neuron disease. That's very difficult to reverse. Very difficult to reverse. I found that the correlation actually is the soft drinks. Soft drinks. I've noticed that all the patients that come to me with MND, they like their soft drink. So.
And is that diet soft drink?
Oh yep. I've seen that as well. The other one is type 1 diabetes. Type 1 diabetes. Well, I mean, it's just like, if they remove the gallbladder, for instance, they're going to have stomach issues for the rest of their life. So I can only help manage it. Mm-hmm. It's the same thing. Once you get something removed, well, pretty good. You're getting rid of that organ completely. So how can I help that organ work better if it's not there? See what I'm saying? Mm-hmm. So same with type 1. If the pancreas is completely shut down and it's not producing any insulin, then yeah, that's that. Or some people just aren't born with a pancreas.
Right. Wow.
The other one is cancer. If they get cancer of the pancreas and they have to cut it out, then same thing. It's I can't replace the pancreas, so I can only help the pancreas create more of what it's supposed to do, which is produce insulin. It's the same with the gallbladder. It's supposed to provide bile. If they get that removed, well, same with the thyroid. If the thyroid gets removed for whatever reason, then that's an issue. Same with structural issues. So when they've got bars in their back, they've had their spine fused, multiple vertebra and stuff like that. Then it's very difficult to reverse it. They can only just manage it, really.
Wow. Well, I guess we're both really lucky that we have pretty good health.
Yeah. So if the doctor says they're going to remove something because you don't need it, which is a common one for gallbladders, I personally would be asking for another opinion or go and see someone alternative. That's my thoughts on that. But if you've got cancer or somewhere and they got to cut it out, well then, that comes back to what were you doing to prevent it?
Yes.
There are ways of preventing these things.
Yes, and I'm a big believer in that. And because I really don't think the Western medical system goes down that road at all for prevention. They don't really look at it at all.
It's definitely a reactive medicine. It's definitely a reactive medicine.
Yeah, and so I do see acupuncture. I do see, an acupuncturist and Chinese herbalist, and have done for decades. So, is there anything as a closing statement? Because we'll finish up now, Scott. We've talked for nearly an hour. In fact, if you count the little bit beforehand, we've talked for an hour. So, is there any important information you want to give our listeners, or a closing statement, or encouragement, or a health tip that you would like to add that you haven't already talked about?
So as a general, I actually specialize in fertility now. So, but
I'll just talked about that.
No, we haven't even talked about it. So women's health, poor women, they get a bad deal. They get a really bad deal. That's basically why I got into gynecology and fertility, because the poor girls get a bad deal. So
with hormones, with hormones, or just in general being the mothers of birthing children?
Yeah. So that just in general, you need to spend time on yourself. What do I mean by that? You need to exercise every day, at least 30 minutes. You need to eat fresh is best. Fresh is best. Okay. Try and get your mind as silent as possible. So meditate if you can. Prayer, if you want to use prayer. Prayer is a good meditation tool as well. I use EFT, emotional freedom technique. So tapping to help myself break through any barriers that I have, any blockages. That's basically it. You need to spend some time on yourself. The only supplement that I endorse is Zinzino oil.
Oh, yes.
So it's an oil that increases your omega-3 and decreases your omega-6 in the bloodstream, and Kangen water. So we're 75% water, guys. So yes, I know the nutritionists will be upset that I say this, but you're only treating 25% of the body with food. The other 75% you need to nourish with water. So the best quality of water that you can get, the better. So that's why I use Kangen water. It's a Japanese ionizer, and it filtrates the water as well, and it turns the water into an antioxidative, get it right, and alkaline water. So and you can research that if you want to, as to why I do that. And that's about it, Karen. Thank you very much for having me on.
Thank you, Dr. Scott. It's been really interesting. But before we go, I do want you to just give a little bit more information about how you help women who are families, couples who are wanting to have a child and they haven't been able to get pregnant for one reason or another, and they come to you, Dr. Scott, and do you help them? Have you got examples, or have you helped women to have babies who haven't been able to? Let's just put that in before we finish, because I think it's a very, very important topic.
So that like I said before, on the door of last resort, so they've already been to the IVF specialist. They usually had at least 2 or 3 rounds at least. I've had patients come to me 7 rounds of IVF, and so what I do now is, if they just want adjunct, so there's a lot of research now that proves that acupuncture with IVF works really well together, and it improves your chances of falling pregnant and also giving birth. Because some women can conceive, but they can't. They miscarry before full term.
Yes.
So acupuncture also helps with that, with IVF to go full term. So that.
Wow.
So IVF doesn't really help with the birthing situation, but whereas acupuncture does. So how does it do it? So basically, like I said before, we're just tricking the brain into sending blood to that area. So the baby needs blood too. It needs nutrients from the blood so it can grow. So that's what basically I'm doing. And also women with endometriosis, so inflammation of the endometrial lining, polycystic ovarian syndrome, so cysts on the ovaries,
yes,
and fibroids. Now those last 2 especially, it's just surgery. It's medication first, but normally that doesn't work. So it's usually surgery. That's why I say I can help them avoid surgery. So because they either try and scrape the fibroids out or the polycystic ovarian syndrome out, or they just try and rip everything out. Hysterectomy. That's good, not good if you want to fall pregnant. So that's what I say is that I help. As I said before, the blood is a cleaner like truck too, so it breaks up any of that garbage that you've got down there, and it takes it where to the kidneys and liver, and that's what acupuncture does.
Wow. So you can help with endometriosis.
Yeah, definitely, yeah. Herbs is really good too. I call it a DNC. Have you heard of a dilation and curette?
Wow.
So that's where they go in. They go in and clean it all out. Well, I call it my herbal DNC. So it basically cleans out the uterus and breaks up all that garbage.
It's amazing because that's actually hereditary. They say I had it. My 2 daughters, both my twins got it, endometriosis, and we both had it. Operation to sort it out.
So there is there's a formula that I made up. It's called women's health support, and that's what it's basically for: endometriosis, for polycystic ovarian syndrome, for fibroids.
Wow, I had no idea that Chinese herbs would treat that. And I was well before I started seeing a Chinese herbalist when I was involved in endometriosis with myself and my children. So maybe with my children I was, but I didn't know they could treat it. So that's amazing. That is so good. There's so much here in this interview with you, Dr. Scott. I hope many, many women watch it. I will definitely repost it and ask women to watch this. And you do it too.
Yeah, I'll be sure. Oh, definitely. I'll get my VA to share it.
Put some posts up and draw it to the attention of women. It's also going on YouTube and on Facebook. So thank you once again. Amazing, amazing information that you've given us and a whole different perspective on health. Have a good week, Dr. Scott, and maybe we'll do another one on more.
We'll do a reciprocal.
Yeah.
Yeah, you can do one with me. I'll be the host. You can be the guest.
Okay, so thank you again, and we'll go out now, and everybody have a wonderful day. Have a wonderful day, Dr. Scott.
Thanks, guys. Thanks for having me, Karen. Appreciate it.
You're welcome. It's really